Welcome to the GTI Faculty Portal. We are honored to have elite faculty like you on our team.
I want to show you how to adjust the ventilator to accommodate for hypercapnia. Many patients that are admitted, particularly in the emergency department, or say on the floor and had a rapid response and you had to intubate on a hospitalist service, or even a patient that's in the ICU that was not ventilated and developed acute respiratory failure and required intubation. You're going to intubate, set up the initial mode and the settings for the ventilator, but then you're going to get an ABG and you're going to have to adjust the vent. So I want to kind of give you this little skill set. It's pretty easy, but I want to kind of give you an example. So let's talk about the vent settings. So let's just say you just intubated a patient. You ordered that the patient be put in a volume control, or VC. Now, when I give orders or even write orders electronically or just handwritten, what I try to do for vent setting is, one, I put the mode first, and I give the order verbally like that too. And then I sort of separate oxygenation and ventilation parameters separately, and it kind of keeps me organized, and I just do it over and over again, and that repetitiveness provides some standardization for the way we give orders. So for the oxygenation parameters, you're going to give orders for FiO2 and of course PEEP, and that's the only parameters that will affect oxygenation or your SAT or your PaO2, your partial pressure of oxygen on the arterial side. That's from your ABG. Next, ventilation. So the ventilation is of course really CO2. So those parameters in volume control are going to be your tidal volume, your respiratory rate, and if you had SIMV, you would have pressure support. But as you recall, volume control does not have pressure support, so we won't talk about that here today. So let's give an example of this. So let's just say you intubated a patient. The initial settings were 100% FiO2, a PEEP of 5. If you'll remember, our tidal volume from that patient was 479. You initially set his respiratory rate to 10. You've intubated, you gave these orders, you say ABGs in 30 minutes, you're praying that they are sent to the ICU or a pulmonologist or a critical care intensivist shows up to start managing, but they don't. What do? You're going to look at the ABG, and you're going to be able to manage this using just one formula. It's really great. So let's look at the ABG. The ABG comes back. We're going to say it's a pH of 7.28, a PaCO2 of 52, the PaO2 is only 62, and with the bicarb of 21. So I need to adjust some parameter over here to correct this respiratory acidosis. He's hypercapnic. We know PaCO2 should be between 35 and 45, and I do want them to get close to the range, but you never want to have drastic changes. I would never try to increase the rate or the tidal volume to get to a PaCO2 of 35. I actually would be happy if I could just get it to maybe a 40. So that's what I want to do. My goal is to correct this acidemia, and I want the PaCO2 to be 40. How do I do that? Great formula. So first you're going to do the current CO2 and divide that by the desired CO2. That's what you want it to be. That's going to be our 40. It's a cross multiplication formula, and it's really based off of minute ventilation, but we kind of tweaked it a little bit. It's very valuable. So over here, we're going to have rates. The unknown rate is what we're going to order to correct it. So that's going to get the X, or the unknown. And then I simply just look at the respiratory rate, and it's currently 10. So you're going to do the current rate. All right, got the formula? All right, here we go. So let's plug these in, okay? I'm going to try to, I'll put them right over here. So the current CO2 is 52. The desired CO2 is 40. The unknown rate is what we're going to find out. And then the current rate is 10. It's right there. So 10. Easy. Cross multiplication. So 40 times x equals 52 times 10, which is going to be 520. And if you divide that out, it's going to give you 13. 13. So all I have to do is increase this rate from 10 to 13, then get an ABG in 30 minutes to 1 hour. Try this. I've taken care of lots of patients, 20 years. 3,500 patients, a third of those on the ventilator, times 17 years. Pretty consistent. You will be amazed how accurate this is. So try it in the clinical setting. We'll review it one more time. All you have to do if you're trying to correct the CO2 is take the current CO2, divide it by the desired CO2, cross multiply with the unknown x of the rate you want, and divide it by the current rate. And that should give you an x of the adjusted CO2.